Thank you, Governor. Good afternoon, everyone. As was posted on the data dashboard on the Rhode Island Department of Health's website earlier, we have 317 new cases. That brings our case total to 4,491 for COVID-19 in Rhode Island. Unfortunately, we also have a number of fatalities to report today. Our number previously was 118, and with 19 additional fatalities we're confirming today, we now have 137 total fatalities. One person was in their 30s, 2 in their 50s, 3 people were in their 60s, 4 were in their 70s, 7 were in their 80s, and 2 people were in their 90s. 10 of these people lived in congregate care settings. 17 of these fatalities occurred within the last 24 plus hours that we report this out, and 2 of them had occurred the day before. Our hearts and condolences continue to go out to the families and the staff persons and extended family members involved with these situations. Yesterday, I detailed the many ways in which we are looking to face the very difficult challenges at our nursing homes and in our congregate settings. I spoke about all of the efforts that are currently ongoing and talked about what we are looking to develop and continue to advance going forward. The Governor and I want you to know that we remain committed to keeping residents in these and other congregate settings safe while supporting nursing homes and other congregate settings staff and leadership. We are also committed to continuing to address the needs of communities throughout Rhode Island, in addition to those within congregate settings. We have, for example, an outreach plan in place, action steps that are being taken to help address the concerns that we acknowledge are occurring with communities of color in terms of the data. I can share a note about the outreach that is ongoing. While 45% of cases of COVID-19 happen to be among the Latino population from the numbers that we have sampled, we may have some of these numbers as a result of the outreach efforts being made, and we know that we need to continue to advance the outreach and the response and making sure that all communities have the support they need with the access to testing and the services needed as well. We have made sure that our materials on testing and other services are available in Spanish. We want to continue to improve that and ultimately begin to expand to other languages. We regularly have colleagues call into our Spanish radio stations to give updates on COVID-19 and the need for testing. We want to continue to do that more and engage all of our racial and ethnic radio stations and media outlines to be able to communicate actively with the communities that we need to. And we've also made sure that the public knows and want to continue to reiterate the importance that everyone knows that there are no barriers to getting a test setting site set up throughout the state, and to make sure that no one worries about immigration issues at any of our testing sites. We have an expansive list of locations throughout the communities that's been informed by community leaders, informed by our health equity zones initiatives and partners, and informed by residents of communities so that we can make sure accessible testing is set up in areas throughout communities involved where people can walk to get tested or go to local areas where they are used to being able to get the information and resources that they need so that access to testing can be available from that standpoint. We welcome the opportunity to continue to expand that, and that's where I'm referencing that there aren't any barriers to setting up testing sites to address that. Another bit of feedback we're getting from people's calls and emails is about wearing facial mask coverings. Wearing a cloth face covering or a face mask in a public setting does not negate the need to keep social distancing standards in place. Just because you have a face cloth covering or a face mask in place in a public setting, it still means you absolutely need to abide by the social distancing requirements that we have said. That's standing at least 6 feet apart or more. We've been hearing reports from some Rhode Islanders who are concerned that while grocery shopping, for example, where they are respecting the 6-foot distancing standard, someone else comes close to them and reaches in to grab an item on the shelf. To be clear, our guidance on social distancing has not changed with the addition of wearing a face cloth covering. Wearing any kind of covering over your nose and mouth does not make you invincible to the coronavirus. We must continue to do both, wearing a face cloth covering as well as respecting the social distancing boundaries that are in place for a reason. I'll finish with saying that yesterday Governor Raimondo spoke movingly about bravery, about how we're all going to have to be brave in small ways and in big ways. Today, I'll pick up on the governor's theme for a moment and talk a bit about how we can all be brave. In doing so, how we can become a more resilient community together. Looking after our families and looking out for our neighbors are acts of bravery, and they're at the heart of community resilience. We want to help make sure that every community from every zip code has the resources and the support they need, and that you have the empowerment, the courage, the bravery to be able to look out for your neighbors, be able to advocate for others, be able to reach out to the seniors or those with differing abilities who are not able to get out and get access to the food that they need, to pick up the phone and call someone and reach out. Let's make sure that we ourselves are doing the things even if we don't want to do them, because that is what being brave is and makes our community stronger as well. Quarantining, staying close to home, going for a walk or a run in our neighborhood versus driving to a state park to exercise, these are the practices that are selfless and brave and help make Rhode Island a more resilient place that's better able to blunt the impact of COVID-19. Being optimistic despite grim statistics, despite grim weather, that's brave. Being able to support each other, being tenacious, continuing to push forward. It's the harsh reality that we have with the cases that are in place, but we want to continue to encourage the bravery that's there as well. Continue to document your contacts, continue to stay at home, continue to call and reach out to the neighbors and the colleagues that you have. In a pandemic, more than ever, the actions we take to support and protect each other can and will reverberate broadly throughout our community. That's what's going to help us get through this together.